It's now time to move this class and the lectures and your presentations into what are called clinical interventions. It starts with an understanding that there are three basic areas where we can help our clients deal with the effects, especially of generalized anxiety and generalized depression. The first one is related to serotonin. Like, are they meeting diagnostic criteria that you would recommend they talk to their medical provider about taking a serotonin medication? And we'll talk about that today in this lecture. The next area, the second out of three areas to emphasize with your clients, are change and CBT. So basically, change is things aren't going well in their life, to put it simply. You want to help them make change, especially to eliminate stress, and especially toxic stress or even traumatic stress. And then CBT is changing their beliefs and behaviors, cognitive behavioral, changing their beliefs and behaviors about themselves and their lives and their emotion and what's going on. That's the second area. And the third vital area are caring relationships. When we feel love from other people, when we are in caring relationships, it actually creates a cascade of chemicals interacting with the tissue in the body to create the feelings, especially of the joy response, which help us be more resilient to things causing fear and anger responses and help us heal from a lot of toxic stress or traumatic stress. So those three areas are all equally important for you to help your clients the most and the best. This relates specifically in this class to the three different areas of brain health, psychological health, and relational health. So today we're talking about brain health, and then psychological health comes next with your interventions, what you're going to present to your classmates in July. And then I'll be talking about a CBT for psychological health at the end of that, along with a lecture about relational health also. So today we are beginning with brain health and talking about what you can do to help your clients address brain health for them, which is reversing the effects of toxic stress and traumatic stress. So first of all, here's a graph from the Center on the Developing Child at Harvard. And it's a great graph to show, like, when we're younger, like on the left-hand side of the graph, when we're 2 and 4 and 6, the brain changes really quickly in response to changes in their life or experiences. So if a child is living in toxic stress and that goes away and then they're living in love and a lot of caring relationships, brain changes quite easily according to the research. But as we get older, it takes more effort to make brain change. And when is it like? It looks like it's like at age 28 or 29 that it intersects. And so as the graph goes up to the right, the amount of effort such change requires means like more things need to happen, which is what we're going to talk about today. That in childhood, a couple basic changes fundamental and the brain goes right with it. But as we get older, more things we need to do for brain health. And this, of course, is all about neuroplasticity because as a child, neuroplasticity is quick and easy, relatively speaking. And as an adult, it takes more effort. So to repeat myself from several times, to be clear on this, toxic stress or chronic high fear response all the time affects brain architecture, but it's reversible and it can be returned to previous functioning or even healthier functioning with your clients. This, of course, is Big Amy and Small Hippo. Seen that many times in this course, resulting in, diagnostically, as we've talked about, and just recently, generalized anxiety and generalized depression. One of the questions for you as you diagnose and treat your clients is whether or not you feel that medication should play a role. And you'll get a feel for this over time. But the point is, sometimes it does, and sometimes it doesn't. And it's up to your client and their medical provider if they go forward with that. But there are other brain treatments we'll talk about briefly today that you really want to know about and look for all of those on your own that really do affect brain health, that really do make changes in terms of neuroplasticity. And just got a couple examples here. So to start off with, the evidence is absolutely compelling and consistent that serotonin medications shrink the amygdala and grow the hippocampus. I mean, I've seen it in research all over the place over the last number of years that I've done the research, as well as seeing it in my clients, that people with generalized anxiety disorder, when they take a serotonin medication over time, 1 month, 2 months, 3 months, 6 months, it goes away. They may be left with situational anxieties, but generalized goes away because Big Amy shrinks. And the same is true for an atrophied hippocampus. Again, rarely, but if you see that, serotonin medication, again, the research is full of this to do this, but it grows the hippocampus. And what that means for your clients is they start to feel again. They're not flat. They start to feel again. They start to feel all parts of life again, including happiness, of course, and most importantly. But for medication, for serotonin medications, it's only if necessary. Again, if the symptoms of generalized anxiety or generalized depression exist. Situational anxiety and situational depression, I, as a clinician, I don't see medication doing much. I just don't. It's mostly about change, CBT, and caring relationships. So what your job, as you go out into being a therapist after this program, is to be able to evaluate your client accurately. And if you feel like a medication might be extremely helpful to them, you can simply encourage them to talk to their provider about that. It's up to them, it's up to their provider, but you can encourage that to happen. Now, when it comes to medication, this is true. I've been a therapist 25 years now. I have never seen it not work on generalized anxiety, most typically, and sometimes generalized depression if I see that. I have never seen it not work. Again, with a big Amy, generalized anxiety, it works every time. The person, your client, may need to find a second medication, and we'll talk about that in a second. But when they get on the right serotonin medication at the right dose, it can't be a low dose in my experience of working with people. It has to be the right dose. Whatever that dose is for them, they work it out with their medical provider. But at the medication at the right dose every single day, starting at day one, and I've seen the research on this, starting at day one, it starts to shrink the amygdala. One dose of a serotonin medication will start to shrink it. It's just that it takes a long time to shrink it down to a point where people don't feel big Amy generalized anxiety anymore. Situational anxieties, sure, and they must happen for us to survive, but generalized is gone. And that is a huge benefit to your clients who are experiencing that kind of big Amy generalized anxiety, especially. Now, here's an important warning about medication that you as a therapist, I encourage you to know this because you can work with your clients on this. It's up to their doctor, their medical provider, and what to do, but you can watch for the signs. So in the article, in the module, you'll see that research found that 15% of respondents have increased anxiety from taking a serotonin medication. And basically what that means, it's the wrong one for them. Whatever one it is, it's the wrong one. And so what they do is they talk to their medical provider about switching. They talk to their provider about switching. What's important about this, if it's not caught early, the anxiety can get so big that they start thinking of suicide, as in, I felt this kind of anxiety, this awful for such a long time. Now I decided to do medication and I feel worse. I'm hopeless. I can't take it anymore. What is the solution? It's called suicide, ending the suffering. Or also, they can give up on medication. Like, I felt this for so long. I took a medication, didn't work. It's useless. I'm doomed to feel this way the rest of my life, which of course is very depressing. So you want to catch this early if they have increased anxiety. And what I recommend you do, which I do with my clients all the time when they start, is to have them text me every day for 7, maybe 10 days. And if they don't feel increased anxiety after 10 days, they probably won't. They can talk to their doctor. They should talk to their doctor about this, but that's my experience is after 7 to 10 days, it's going to be fine. It's just going to take a while for it to really make a difference, but at least they're not having that initial high anxiety. Now, moving on to other brain health treatments. One, of course, is to reduce stress, helping identify your clients where they're experiencing stress, which is usually a fear response, can be an anger response, but whatever parts of their life causing that. If they can change it, eliminate it, reduce it, you want to help them do it in whatever parts that are causing that kind of stress response. Another way of affecting brain health is this one, mindfulness-based stress reduction. Again, literature is full of research on how that practice, when done right, does shrink the amygdala. And so I'm not sure exactly how it works, except for the meditation part, the non-judgmental acceptance of emotions, especially fear or anxiety part, the focus part, all the things. I don't do it. I'm not training it, but the research is clear, and people tell me when they do it, if they do it, that helps them feel better. But the research, again, is on shrinking the amygdala when done right. This next one is exercise. And again, the research is clear that good, consistent quality exercise grows the hippocampus. And in Dr. Thuray's TED Talk, you would have seen that as one thing she recommended. So I've not seen any research that say exercise shrinks the amygdala, but I've seen the research that it grows the amygdala. Grows the hippocampus. So that's something to recommend to your clients about doing to affect positively their brain health. This next one is by far the most important thing to encourage your clients to do, or to be involved with and spending time with really great people, or in mutually caring relationships. I will define this very clearly in the lecture on relational health, but to feel loved, to be loved, again, causes a cascade of chemicals in the brain to the body, the tissue, and back and forth again, so that a person feels great. And that feeling also helps us with resilience, helps your clients with resilience to the fear response from toxic stress and traumatic stress. So mutually caring relationships, one of the most important things you can help your clients do is to achieve and maintain those in their life with incredible biological and psychological effects. This slide is a return of a previous slide on bigger Amy and smaller hippo. The idea there is, like, if you're evaluating and diagnosing a person with probably a bigger Amy, but not huge, or a smaller hippo, but not really tiny, so to speak, medication, the serotonin medication, may not be vital. Again, serotonin medication is typically Lexapro and Zoloft, and I've seen research that they lead the field in these worldwide studies. But there's also Effexor, Celexa, Paxil, and others. So serotonin medications may not be required with a bigger AMA. It's up to your client and what they do with their doctor. But in terms of what you recommend they do to see a doctor or a medical provider, but to know that with a bigger AMI or a smaller hippo, not hugely big AMI and hugely small hippocampus, these other brain health treatments like exercise, like mindfulness-based stress reduction, and especially caring relationships, mutually caring relationships, can work, medication not required. So that's something you want to evaluate and look at. A few more slides on brain health before this lecture completes. One is panic disorder. This is a really important thing to eventually understand. Again, you're not at a point now, being a student in your classes, in your internships, you probably have seen it, and personally or professionally, but panic disorder is a really big deal in terms of other situations related to brain health. So with generalized anxiety, a person can start having panic attacks, which is literally, and the Center for Anxiety and Related Disorders tells us, is having fear about fear, or a fear response about a fear response, You really call it a survival fear response about a survival fear feeling. So that's what a panic attack is. And a panic disorder occurs when a person is living in constant fear of having another panic attack. So panic attacks can happen once in a while, and that's it. But for some people, after a long time, maybe it's years, not really sure, but then you start having this fear of having another panic attack, and that's what we call panic disorder. In this situation, in my opinion, medication is vital. I don't think it's optional, but that's my clinical opinion as a therapist. It's up to you what you want to do, and most importantly, the person's medical providers. But when they don't have medication, they've got a big Amy, then they have panic attacks, and then it's panic disorder. Shrinking big Amy is hugely helpful because after that happens, then the CBT, the change, and the relational stuff can make a difference. Before that, those other things don't seem to make a difference. It's like the person is just living in way too much fear. And then the last thing to know is like, if we do not accurately diagnose and treat panic disorder, clients are at a high risk for suicide. Meaning, like, most people think that people commit suicide or think about it because of depression. And that is obviously true. But a surprising number, and it could even be, in my opinion, the majority of people think about it because of generalized anxiety or big Amy, panic attacks continuously, and panic disorder. Like, you just can't live like that anymore. And suicide becomes an option. I just cannot live like this anymore. So that's why panic disorder is such an important thing to know about. And as you get out into your career, keep learning about it's kind of rare. It's not, most people have a big Amy. That's like the most common thing I see in terms of mental health difficulties. But it can become panic attacks and then later panic disorder. Another consideration is alcohol. You really want to understand alcohol and big Amy. It's a really important combination because what happens is when you're living in constant fear from a big Amy, anybody is going to gravitate towards anything that reduces it or stops it, like anything. You just can't live like that anymore. You got to make it stop. Now, why the reason that alcohol becomes, positive or an option is because alcohol, like benzodiazepines, bathe the fear response. They just bathe it. And so, like, if you're experiencing a lot of anxiety, and certainly big Amy anxiety, and you have a drink, it just calms it down temporarily. And that, of course, is the problem. There's the inebriation part, and then there's the temporary part, and then you want more, and then you have to take more to bathe the fear response the way it did the first time. You go on and on and on, and then it can become an addiction. But you just want to know this connection between big Amy, alcohol, why people turn to it, and why they keep with it, why they stay with it. You also want to know, like, that's why, like at parties and things, people offer alcohol quite often because it's a social lubricant, because it reduces this small fear response, this nervousness we have about being in public at a party or something. So it's so clear if you look at it that way, like, oh yeah, that's what alcohol does. It bathes a fear response, even in a small way, for small reasons like nervousness at a party. But like I said, this is why some people, maybe a lot of people, become addicted to alcohol because nothing else has worked in their entire life to reduce or eliminate their generalized anxiety. Again, with your treatment, with your CBT, with caring relationships, and serotonin if they need it, the alcohol becomes not necessary. If there's an addiction, there's addiction counseling. Obviously, there's you if you do that. There's AA, incredible program. So all those things can go together to treat your clients with an addiction if that has occurred. We just want to know the connection between big Amy and alcohol and why people use it for that purpose. So as we look at what we're doing now, today, and then in the next several weeks with CBT and everything, that this is a great quote. CBT or CT, cognitive therapy, directly enhances prefrontal function and top-down emotion regulation and cognitive control, whereas antidepressant medication, meaning serotonin medication, alters amygdala activation and bottom-up stimulus-driven processes. So this line from this research tells us why when people have a big Amy generalized anxiety especially and small hippo, that kind of generalized depression, why the combination of the medication and CBT they get from you works together, including, this doesn't even talk about caring relationships, but you add that in and the trifecta. That's what you want to know. That's what you want to help your clients do. So in the final slide in this lecture, it's all about understanding that CBT is one of the big changes that you can do and help your clients with. These are effective cognitive behavioral treatments. I will talk about one at the end of July, but now after this, it's time for you all to present your CBTs that you have found for treating anxiety and depression, both situational and generalized for each. And we're looking forward to it. Until next time, again, looking forward to your CBT presentations next.